watching The Great British Breakfast. Good morning to you. Now, violence continued across Europe for a third day in a row as protesters fight back against new COVID restrictions. In Brussels, riot police were forced to use water cannon and tear gas against demonstrators opposed to the introduction of COVID passes and plans for mandatory vaccines.
Well, meanwhile, in the Netherlands, a 3-week partial lockdown was imposed after a record spike in COVID cases. Riots broke out in Rotterdam on Saturday, where police fired gunshots. On Sunday, fireworks and rocks were hurled at police in The Hague. Finally, tens of thousands of people protested in Austria's capital, Vienna, after the government there announced a new national lockdown and had plans to make jabs compulsory in February of next year.
Well, let's talk about that and other headlines of the day. Jason Reed is UK lead at Young Voices, his political commentator, and Jason joins us this morning. Good morning to you.
Good morning.
Jason, we don't have to look very far to see the anger in Europe over the reaction there to the spread of COVID. Do you think there's a risk that we could be next?
There is a risk, but we've been assured over the weekend by Professor Sir Andrew Pollard, who's director of the Oxford Vaccine Group, that we are perhaps unlikely to see the same spike in this country that other countries, like you mentioned, Belgium and the Netherlands and others across Europe have seen, because earlier on in the pandemic, the UK's COVID cases were higher than a lot of those countries, and we have a stronger immunity as a population to the Delta variant, which in particular is causing these spikes and leading these governments to implement all these new restrictions. So the situation is optimistic at the moment, going by the scientific advice. At the same time, there is always a risk. At the press conference last week, Boris Johnson was talking about a blizzard of COVID, talking about it almost like a weather front coming across Europe towards us, and Sajid Javid making clear that more restrictions are not off the table if they're necessary in the coming weeks.
When you mention those restrictions, what would those be?
Well, the restrictions that we've seen across Europe, which if there's a similar spike in this country, is likely to be implemented here as well. You mentioned there was a 3-week partial lockdown in the Netherlands, tighter restrictions on face masks. We've already seen controversy over the decision to mandate vaccines for those working as health workers and carers. So similar restrictions along those lines. Possibly, I think it's likely we would see restrictions on big crowds at sporting events and concerts and things like that. So those kinds of gentle introductory lockdown measures that we saw earlier this year and last year to try and see off any spike.
Now, looking at what's happening here in the UK, Sajid Javid was on the telly yesterday. There are a record 6 million people on the NHS waiting list for treatment. That's going to be a story that just gets bigger and bigger, isn't it?
Exactly right. And even Sajid himself says that the waiting list will only get worse before it gets better. The NHS is under unprecedented demand. Of course, we're heading into winter when demand is always going to be tough for the NHS anyway, combined with the potential for an increase in COVID cases, combined with the huge backlog, which currently stands at about 6 million cases. Chris Hopson, the chief executive of NHS providers, is very concerned about this. He says that even when case numbers are low, even when it's only a small proportion of hospital beds that are taken up with people who are suffering with COVID, it still has a significant effect in winter because some other beds are out of action, because you have to protect against COVID infection, so you can't use beds in the normal way. And so it can be a significant proportion of the beds in hospitals that are unavailable at a time in winter when the NHS is often very, very close to capacity anyway. And so even if COVID cases do remain relatively low, we might still see a situation where the NHS gets very close to being overwhelmed over the next few weeks and months.
Yeah, let's just talk briefly, if we can, about social care, because there's this new social care cap, the sort of maximum price any individual could have to pay for their social care. Lots of charities have said this really is going to hit poorer people the hardest. What do you make of the government's sort of latest version of how they're going to handle social care?
Well, social care is one of those issues that just never seems to go away, and there isn't an easy answer to it. This new plan for an £86,000 lifetime cap on contributions to social care will be debated today by MPs. Because of the government's significant parliamentary majority, it seems likely that it will pass, but there is a lot of discontent, especially on the Tory backbenches, around this, which of course the opposition, the Labour Party, are very keen to exploit. They're trying to encourage Tory MPs to vote with them against the proposal. It seems likely it will pass, but at the same time, it also isn't out of the question that there might be a U-turn further down the line if this kind of rumbling discontent continues, because as you say, there is a lot of concern from charities and all kinds of welfare groups that this will hit poorer people the hardest. People with modest assets, as Labour puts it, especially pensioners, are going to be hit hardest by this new plan to tackle the immense cost of funding social care.
And of course, those Tory backbenchers are the ones who snatch seats from Labour, who are hearing from their constituents about levelling up. And here we have something that would appear to do the opposite.
Exactly. Yeah, Boris Johnson has made levelling up Britain the plank of his premiership, and so he's very keen to be seen to be doing things for people in the North and the Midlands who lent their votes to the Conservative Party in 2019 for the first time in a generation. And so the Red Wall MPs, the new MPs elected in 2019 in those constituencies, are very concerned indeed that this is going to hit their constituents disproportionately hard. And so quite understandably, they have concerns around that, and they're not terribly comfortable with this plan as it stands.
Well, it's great to see you, Jason. Thank you very much for your time this morning. We'll see you again soon. Jason Reed.